Hello, my name is Sarah Parker, and I'm an MSN student at Eastern Kentucky University. At this time, I'm going to go over an integrative review presentation. Now, what is the problem? Adults that are in need of recovery from alcohol and other drugs have many options, such as outpatient assistance, inpatient assistance, and residential treatment facilities, which are also called RTFs. According to Healthy People 2020, in 2009, 95% of the 22 million adults that suffered with addiction are unaware of their problem. And unfortunately, the 273,000 that recognized their addiction were unsuccessful in obtaining treatment. Even though adults have many options for recovery, RTFs may provide the best outcome for sobriety because of their support that's included. Short-term RTFs offer a 12-step approach for a 3 to 6 week time frame and continue recovery as an outpatient with the inclusion of support groups such as AA. Long-term RTFs offer 24-hour-a-day care for 6 to 12 months that focus on resocialization and usually comprise of individuals that need behavior therapy to function in society. 2 literature reviews were studied. The first one I'm going to speak about is by Harvey and others in 2016 conducted a study to examine risk factors for substance use relapse among residents in Oxford houses. The intervention was based on Bandura's cognitive behavioral self-efficacy theory. Data was taken from archival datasets of studies by researchers from DePaul University in 2000 to 2003 and compared to secondary data analysis pertaining to relapse of residents that stayed at Oxford houses and discharged on day 120, 240, and at the end of 1 year. With a sample size of 268, the participants included men and women living in Oxford houses. The attrition rate was 102 with no reason given. There were 4 measures used. The first one was ASA Lite, which assesses problem areas commonly related to alcohol and other drugs. The second one was Alcohol Abstinence Self-Efficacy Scale, which is also called AASE, and Drug Abstinence Self-Efficacy Scale, DASE, which is a third one, and that one was from Bandura's Cognitive Behavioral Self-Efficacy Theory. It is a questionnaire that was used to determine how resistant participants were in resisting alcohol drug use in 20 high-risk situations using a 5-point Likert scale. The last one was Miller and Del Boca's form, 90 timeline followback, which is a questionnaire that was used to evaluate triggering events for relapse. In this study, a total of 87 participants reported no use, 75 relapsed, and 102 dropped out. The second literature review is by Daughters. Now, Daughters and others in 2017 conducted a randomized controlled trial study to compare outcomes for behavioral activation group treatment for substance use versus time and group size match control condition delivered in an RTF setting. This study was based on the reinforcement theory, with a sample size of 263 and 8 different attrition patterns observed. All participants at a 136-bed RTF center received treatment as usual and were randomized by group to receive behavioral activation or supportive counseling with post-treatment follow-ups at 3, 6, and 12 months. There was no basis in clinical characteristics, however, must be either court-mandated or volunteered. The exclusions were less than 5th grade reading level, current psychotic symptoms, initiation of psychotropic medications within the past 3 months. The interventions used were, it included participants with treatment as usual, 30 to 50 patients, and they used Less Act, and it is a behavioral activation treatment and treatment as usual, and participants with supportive counseling with treatment as usual. A structural clinical interview for the DSM-4, timeline follow-back interview, back depression inventory, short inventory of problems, alcohol, and drugs. During the study, the Let's Act group showed a significant rate than any other group for rate of abstinence at 3, 6, and 12-month intervals. From pre-treatment to 12 months post-treatment, Let's Act showed significantly fewer consequences. Participants in the Let's Act condition reported greater decrease than the control condition from pre-treatment to 12 post-treatment. Now, how can this literature help in practice? Advanced practice nurses that may work in RTFs can use the data from these studies to know what time frame would be appropriate to prevent relapse. Instead of treating patients in a 3 to 6 week time frame, individuals can receive treatment for at least 120 days to produce positive outcomes. Also, in addition to medical stabilization, support based on the tidal model theory by Barker that can address financial, family, social, and emotional issues can be given to increase positive self-efficacy for a better outlook on life, which in turn will prevent relapse. Now, the proposed intervention is that it would be good to offer treatment to adults with substance abuse and mental health illnesses that will include group therapy, 12-step programs, social support, financial support, emotional support, and housing. The minimum treatment would be for 120 days. It would increase self-efficacy in participants based on Barker's tidal model theory, and the use measures would be ASA Light, AASE, and DASE, Beck Depression Inventory, and Timeline Follow-Back Interview for data. A healthcare environment that is appropriate for implementation would be a RTF in Durham, North Carolina, by the name of RI International. This particular RTF is appropriate because it is a RTF for adults over 18 years of age in crisis in need of mental health treatment or substance abuse detox. The facility offers medical stabilization, group therapy, everyday 12-step programs such as AA and NA, and referrals to outpatient treatment. However, the stay is no longer than 7 days. Therefore, the length of stay in addition to treatment should produce a significant decrease in relapse amongst patients. Thank you for this presentation. If you have any questions, please, you can email me at Sarah_Parker79 @AOL.com.